Hello friends, welcome to the video Study Mat with Dr. Roy. Today we are going to study surgical site infections, SSI. So what are SSI? SSIs are infections of the tissues, organs or spaces exposed by surgeons during performance of an invasive procedure. सो ड्यूरिंग ऑपरेशन जो भी टिश्यू ऑर्गन या स्पेसिस जो सर्जन एक्सप्लोर करता है वहाँ पर अगर कोई इन्फेक्शन होता है तो उसको सर्जिकल साइट इन्फेक्शन बोलते हैं. सर्जिकल साइट इन्फेक्शन here you can see the diagram. It is a sutures on the skin. Incision is been made and उस पर suture लगाया गया है. तो अगर यहाँ इन्फेक्शन होगा तो उसको सर्जिकल साइट इन्फेक्शन बोलेंगे. Now when to suspect SSI? So post-operative patient with elevated temperature, tachycardia, tachypnea with increased WBC count. So these are the conditions. मीन्स अगर पोस्ट ऑपरेटिव पेशेंट्स में टेम्परेचर बढ़ा है, टैकीकार्डिया, टैकीपनिया और WBC काउंट बढ़ा है तो उसको हम एसएसआई के फीचर्स में काउंट कर सकते हैं. प्लस जो वुंड है it has signs of inflammation. What are the signs of inflammation? We have right CD. Okay, what is the right CD? Rubor, tumor, calor and dolor. Okay, these are the signs of inflammation. So collectively these are called SIRS, systemic inflammatory response syndrome. Systemic inflammatory response syndrome. So due to any disease like pancreatitis, transfusion reactions, it can occur, or when SIRS combines with any infection it becomes sepsis. This is very important point to remember. SIRS with infection it is called sepsis. Now pathophysiology of SIRS. SIRS is mediated by the production of pro-inflammatory mediators. What are pro-inflammatory mediators? So pro-inflammatory mediators जो होते हैं they could be gram negative or gram positive. Gram negative are lipopolysaccharides and gram positive are peptidoglycans. So lipopolysaccharides are called endotoxins and like we have one trick to remember it, very easy trick. Less lipid and more protein. Less means negative, more means positive. So negative bacteria will secrete lipid means lipopolysaccharide, and more means positive will secrete peptidoglycans. So these are the pro-inflammatory mediators which are present in SIRS. SIRS means systemic inflammatory response syndrome. Next, we are understanding the difference between sepsis and severe sepsis. So sepsis means combination of SIRS plus infection. We have already studied what is severe sepsis. Severe sepsis means sepsis plus organ failure. It's called severe sepsis. What are the symptoms of sepsis? S for shiver or fever or cold. E extreme pain, pale or discolored skin. P for S for sleepy, difficult to rouse or confuse state. I for I feel like I might die because it may be due to discomfort. And S means shortness of breath. So symptoms of sepsis in the acronym or abbreviation SEPSIS. Then PIRO classification scheme. There is one classification for SSI which is called PIRO classification. So P stands for predisposition, I for insult or any infection, R for response, O for organ dysfunction. So predisposition, insult, response and organ dysfunction. Predisposition means what are the factors that predispose or expose any person for SSI, like advancing age. For any patient who have more age is more prone to develop SSI than any patient of younger age going to surgery. Second one is immunosuppression. Then insult, infecting organism or disease location. Location of the disease is also important. Then third one is response, development of SIRS, presence of shock C-reactive proteins. Third, organ dysfunctions, failing organ or dysfunction of organ. So here we have studied PIRO classification. Now next thing is clinical features. We are going to study clinical features in three phases. What is superficial, deep incisional and intercavity. Superficial SSI means superficial features will be there like tenderness, redness, erythema and edema. We have already studied the signs of inflammation. Next thing is deep incisional. Now the SSI has moved to some deeper layers of the skin. Tenderness extends beyond. Okay, So what are the features like vesicles, bullae may be present. This will be come under deep incisional SSI. Then third, intracavity. Now cavities in the body, it depends upon the system involved, like which system is involved. Like if abdominal infection is there, like GIT, so it will cause paralytic ileus. It will be one symptom. So similarly in the other organ systems, we can interpret it. Now, principle of management of SSI. What is the principle of management of SSI? A, B, C, D, E. B is placed just to complete the mnemonic. So A, C, D, E is the original one. Now A for antibiotics. Initially we use broad spectrum antibiotics, but after having culture and sensitivity reports, we can use specific antibiotics. Okay, so this is A. We don't have anything with B. Now C. C means care of the wound. We have care of the wound. Wound dressings are done. Okay, so we have to care the wound. D stands for drainage of the pus. Like if pus will be there, the wound have very less tendency to heal. Wound healing will be delayed. Okay, so dressing of pus, culture sensitivity. After like we can send the pus for culture sensitivity also. So this is also written here. Now E means exploration of the wound or peritoneal cavity. So we have completed ABCD. A means antibiotics, C means care of the wound, D means drainage of the pus, E means exploration of wound or peritoneal cavity. Now, these factors we are going to study. Very important thing. We are studying it with the help of mnemonic. So here we will be studying risk factors for the development of surgical site infections. So there are three risk factors. First one is patient related factors. Second one are local factors, and third one are bacterial factors. Okay, so first we will study patient factors. Patient, PATIENT. So it is a mnemonic in itself. P stands for peripheral vascular disease or any smoking condition. A for anemia, T for trauma, I for immunosuppression, E for elderly, like we have already studied age factor, N for nutritional status, T for too much obesity. I am repeating it again. P, peripheral vascular disease, smoking, A, anemia, T, trauma, I, immunosuppression, E for elderly, like age related factor, N for nutritional status, and T for too much obesity. So we have completed patient related factors. Now local factors. It is itself in the mnemonic LOCAL, local. L stands for long surgical procedures. Procedures which are long of duration. O for oxygenation is poor, means hypoxic conditions. C means contamination of the instrument or skin. A stands for antibiotic prophylaxis, which is inadequate, means insufficient antibiotic. L stands for local tissue necrosis and low temperature hypothermia. I repeat it again. Local L for long surgical procedures. O for oxygen deficiency hypoxia. C for contamination of the instruments and skin. A for anaphylactic measures like prophylactic inadequacy, or L for local tissue necrosis. Then third factor was bacterial factor. Bacterial factor, the name of bacteria we can study: Klebsiella, Streptococcus pneumoniae, coagulase negative Streptococci, which is slimy on the surface, and gram negative bacteria, Clostridium Streptococci. In gram negative bacteria, we have the mnemonic negative lipid, so lipopolysaccharides or endotoxins, gram negative bacteria. Okay, so it is here. Now, another most important thing we should be knowing, like what are the measures we can use to prevent SSI. So prevention of SSI is important. So before telling this, I would like to tell you the difference between sepsis and antisepsis, like asepsis and antisepsis. So asepsis means absence of sepsis, means we are using the measures so that sepsis should not occur. So preventive measures are called asepsis, while antisepsis means the anti means against sepsis, means infection has already occurred, so we are using any the drugs or any intervention to uh, eradicate or to treat the infection that is caused. So in asepsis, our goal is to prevent the infection, whereas antisepsis we are treating to eliminate the infection. Now we can prevent the surgical infections in three stages. preoperative, intraoperative, and postoperative. So preoperative, prophylactic antibiotics we can give, preoperative hair clipping, preoperative antibiotic shower with chlorohexidine soap washes we can use, short stay at the hospital, good nutrition, adequate blood control. Intraoperative asepsis or antisepsis, I have already told it the difference. Avoid spillage of gut content. Good surgical techniques should be done. Avoid hematoma diastasis. Use monofilament nylon sutures. Oxygenation, glucose control. So these are the intraoperative prevention measures. Now, postoperative measures will comprise of control of infection with antibiotics. Remove drain as early as possible, ASAP. Then dressing should be done properly. Early enteral nutrition should be started. Tight glucose control should be done. So these are the three stages at which we can prevent the surgical site infections. Now, antimicrobial prophylaxis. So first we will see what are the site and what are the possible uh, bacteria lying there. So breast, Staphylococcus aureus, coagulase negative staphylococcus, the slimy one, and appendectomy gram negative bacilli anaerobes, biliary tract gram negative bacilli with anaerobes, and upper GI gram negative bacilli with streptococcus oropharyngeal anaerobes, peptostreptococci. So, so you just once we will read it twice or thrice, it will be easy for us to understand. Okay, so breast, Staphylococcus aureus, coagulase negative. Okay, appendectomy gram negative bacillus, biliary tract gram negative bacillus, just like that. Now, cefazolin is generally accepted as the antimicrobial agent of choice for clean contaminated operation. Okay, what is the dose? 1.2 gram adult dose, and no more than 30 minutes before skin is incised. Okay, लाइक ऐसा नहीं है कि हमने अभी यूज़ किया सेपाजोलिन तो हम 2 घंटे बाद सर्जरी कर रहे हैं, नहीं, विद इन 30 मिनट्स हमको यूज़ कर लेना ताकि वी विल गेट बेस्ट रिजल्ट्स. सेफाजोलिन. नाउ प्रोफाइलैक्टिक रेजिमेंट्स. So we have vascular regimens, esophagogastric, biliary, small bowel or appendix or colorectal regimen. Okay, so what we will study, I have one trick here to study esophagogastric, small bowel and appendix colorectal in one go. Like our GIT starts with like oral cavity, then pharynx, then esophagus, then stomach and small bowel, large bowel and all that stuff. Okay, so just study. So esophagogastric, we will be using 1 dose of second generation cephalosporin and metronidazole. Okay, so first dose, 1 dose of second generation cephalosporin and metronidazole. Second, that is small bowel. Here also we will be using second generation with metronidazole, so bowel, small bowel. Then we have appendix and that colon rectal area, colorectal. So here also the same regimen. So in the entire GIT we have studied in 3 parts: esophagogastric, small bowel and appendix or colorectal. We will be using 1 dose of second generation cephalosporin with metronidazole. Okay, now two are left. What are the two which are left? Vascular and biliary. So vascular, 3 doses of fluoxetine with or without gentamicin, vancomycin, and then biliary, 1 dose of second generation cephalosporin. Okay, so here we have completed prophylactic regimen. Then difference between asepsis and antisepsis we have already studied. Like, let's see precautions taken before any surgical procedure, like wearing gloves before procedure, cleaning and draping instruments, sterilization, autoclaving. So it will be under asepsis. Now antisepsis, dressing of an already contaminated wound using carbolic acid, iodine, etc. Okay, so with this we have completed this video. Just take glance in few seconds what are the contents of this video. We have studied what is surgical site infection with, like, we can see one diagram also here. Then how to suspect it is SSI. So we have seen some features which will indicate. Now what is SIRS, and SIRS plus infection is called sepsis. Pathophysiology of SIRS, gram positive, gram negative. We have learned a trick here also: less lipid, more protein. Sepsis and severe sepsis differences, symptoms of sepsis, PIRO classification we have studied, what is the meaning of PIRO and what are the ingredients in it. Clinical features we have studied in three phases: superficial SSI, deep incisional, and intercavity. Okay. Principle of management: A, B, C, D, E. B is nothing, but as A, C, D, E we have studied. Now, risk factors: patient, local, and bacterial factors. Prevention of SSI: three levels: preoperative, intraoperative, and postoperative. Then prophylaxis regimens we have studied, and the difference between asepsis and antisepsis we have done. So with this, I conclude this video. If you have found this video knowledgeful and interesting, do like my channel, share with your friends, and do subscribe it for more valuable contents I will be bringing in the next upcoming videos. Thank you.